Okay, for all things syringes, if you need to fill up feed syringes, the feeds are on the top shelf of the refrigerator. And then next to the sink, there's a drawer that has his feed syringes. They're white, they're pointy tipped, so they're a little bit different than the water ones. I'll grab a paper towel, open up the feed. This is a homemade blended diet, so it's not the prettiest look. And then I kind of pull some up and push it out just to get air bubbles out. I'll tap it on the side, and then I'll rinse it off in the sink. There are 2 feed syringes, so you're gonna do this 2 times. Okay, then this is the feed attachment, but there is also a water attachment. So I wanted you to see the difference. The water ones twist on, and then also for medicine, that medicine Y port twists, and that's how we administer medicine. But this is the feed one. And so you can just poke these skinny tops into it, and then you're gonna prime it, which means you're gonna fill it with food so that no air gets into his stomach. So if I ever ask for you to fill it up, that's how. However, when we're done, medicine syringes will always just be in this little cup. And so to clean them, you just pull some water up and just kind of shoot it out. So these ones are getting cleaned, and then the feed syringes are pretty much the same. Sometimes I will take them apart and use some soap and really get them clean well. But on a regular basis, if you happen to see them sitting in the sink, just a quick squirt will do. And so once I squirt the syringes out and get them nice and clean, then I'll also run some water through the tubing. I think they call it an extension. So if we're getting like all fancy, we'll run water through the extension. And then once they're cleaned off, the feed syringes and tubing go right there back into the drawer. And then the medicine syringes will go in the laundry room, and there is a drawer for medicine syringes. So for the larger one, you'll see there's a container, and then for the green ones, there's a container. So to fill the medicine syringes, that's another thing that's super helpful. And I'm really anal about because these are heart medications. So there is full ones of this medicine. So this is called carvedilol. This will get filled to 12 mLs. It has to be shaken intensely before you pull it up into the syringes. So that's what a 12 ml syringe full looks like of carvedilol. The other medicine he takes, Epined, is in the refrigerator. It has to stay refrigerated. And so he will get 5 mLs of that. The 5 ml syringes are right here. There's actually not that many. A lot of them are smaller or bigger, but we had one left. So I'm going to show you how to fill it up. So you're going to attach like this and then flip it. Okay, you're going to start pulling. If you get an air bubble, shoot it back in and then try again. So we're going all the way to 5 mLs. This is not rocket science, but I do feel like it needs to be really, really close to perfect. So there we go. There's 5 mLs. Then you'll flip it back and take it off.